Rabies. The very word evokes fear. This deadly disease has plagued humanity for centuries. It's a viral infection that attacks the central nervous system. What's shocking? Once symptoms appear, it's almost always fatal. This isn't just a threat to animals. Humans are at risk too. Understanding rabies is crucial for prevention. We'll delve into its causes, symptoms, and how to stay safe. Knowledge is power when it comes to fighting this deadly disease. Rabies is a zoonotic disease. This means it can spread from animals to humans. The rabies virus attacks the brain and spinal cord. It's a global problem affecting nearly every continent. Millions of animals are vaccinated against rabies each year. Sadly, tens of thousands of people still die from rabies annually. Most cases occur in Africa and Asia. Dogs are responsible for the majority of human rabies cases worldwide. However, wildlife like bats, raccoons, and foxes can also carry and transmit the virus. Rabies is a disease of the nervous system caused by the rabies virus. This virus is typically transmitted through the bite of an infected animal, most commonly dogs, bats, raccoons, and other mammals. Once the virus enters the body, it travels through the peripheral nerves to the brain, where it causes inflammation and severe damage. Initial symptoms often resemble the flu, making early diagnosis challenging. These early signs can include general weakness, discomfort, fever, or headache. Fever, headache, and muscle weakness are common initial symptoms. These symptoms can be misleading as they are not specific to rabies and can be associated with many other illnesses. As the virus progresses, more serious neurological symptoms appear. This is when the disease becomes more identifiable and dangerous. These include confusion, agitation, and hallucinations. The infected person may become extremely restless and irritable, experiencing vivid and terrifying hallucinations. Hydrophobia, the fear of water, is a classic sign of rabies. This symptom occurs because the virus affects the muscles involved in swallowing, causing painful spasms when trying to drink. This occurs because swallowing becomes difficult. The throat muscles become paralyzed, making it hard to swallow liquids and even saliva, leading to excessive drooling. Paralysis can also set in as the virus attacks the spinal cord. This can lead to partial or complete paralysis, starting from the site of the bite and spreading to other parts of the body. Ultimately, rabies leads to coma and death if left untreated. The progression from initial symptoms to severe neurological impairment and death can be rapid, emphasizing the importance of early intervention. The incubation period, the time between exposure and symptoms, varies. This period can be influenced by factors such as the location of the bite, the amount of virus introduced, and the individual's immune response. It can range from a few weeks to several months. In some cases, symptoms may appear as early as 1 week or as late as a year after exposure, making it crucial to seek medical attention immediately after a potential exposure to the virus. Welcome to Section 4, How Rabies Spreads Transmission Explained. In this section, we will delve into the various ways rabies can be transmitted from one host to another and the mechanisms behind its spread. So, rabies spreads through saliva. This means that any contact with the saliva of an infected animal can potentially lead to transmission. The most common route of transmission is through a bite from an infected animal. When an infected animal bites another, the virus is introduced directly into the bloodstream through the wound. The virus enters the body through the bite wound and travels to the nerves. It uses the nervous system as a highway to reach the brain, where it can cause severe neurological damage. Once it reaches the brain, it replicates rapidly. This rapid replication is what leads to the severe symptoms associated with rabies, such as aggression, confusion, and paralysis. While bites are the primary mode of transmission, other forms of exposure exist. For instance, if an infected animal's saliva comes into contact with a scratch or abrasion on the skin, the virus can enter the body. Scratches, abrasions, or open wounds can provide entry points for the virus. It's important to clean any wounds immediately and seek medical attention if there's a risk of rabies exposure. Contact with infected saliva on mucous membranes, such as the eyes, nose, or mouth, is also a risk. This means that even without a bite or scratch, the virus can still find a way into the body through these vulnerable areas. To minimize the risk of transmission, always wash your hands thoroughly after handling animals and clean any wounds promptly. Awareness and prompt action are key in preventing the spread of rabies. Now let's move on to Section 5, the impact of rabies, health and societal costs. The impact of rabies extends beyond individual cases. It poses a significant public health threat. The fear of rabies can lead to the unnecessary culling of animals. This disrupts ecosystems and wildlife populations. Economically, rabies places a burden on healthcare systems. Diagnosis, treatment, and post-exposure prophylaxis are costly. In many developing countries, access to healthcare is limited. This makes rabies a disease of poverty and inequality. And finally, Section 6, combating rabies, treatment and care. In this section, we will delve into the critical steps and measures taken to treat and care for individuals who have been exposed to rabies. There is no cure for rabies once symptoms appear. The disease is almost always fatal at this stage, making early intervention absolutely essential. However, prompt medical attention after potential exposure is crucial. Immediate action can make the difference between life and death. Post-exposure prophylaxis, or PEP, is a series of vaccinations that can prevent the virus from taking hold. This treatment is vital and must be administered as soon as possible after exposure. PEP is highly effective if administered soon after exposure. The sooner the treatment begins, the better the chances of preventing the virus from progressing. It involves a dose of rabies immunoglobulin and a series of rabies vaccines. The immunoglobulin provides immediate antibodies to neutralize the virus at the site of the bite. The immunoglobulin provides immediate antibodies to fight the virus. This initial dose is crucial in providing the body with the necessary tools to combat the infection right away. The vaccines stimulate the body's immune system to produce its own antibodies. Over the course of several doses, the body builds up a robust defense against the virus, ensuring long-term protection. Education and awareness about the importance of timely treatment are also key components in combating rabies. Ensuring that individuals understand the urgency and necessity of seeking medical help immediately after exposure can save lives. Community outreach and education programs play a significant role in preventing rabies. By spreading knowledge and providing resources, we can help reduce the incidence of this deadly disease. Remember, rabies is preventable with the right measures. Stay informed, act quickly, and always seek professional medical advice if you suspect exposure.